All right, everybody. So happy Monday. I hope everybody had a good weekend. I don't know how you felt about the Super Bowl, if your team won or didn't win. I don't know how you felt about the halftime show. I don't know how you feel about, the fact that Beyonce dropped in the middle of the Super Bowl and took the thunder, I think maybe from the Super Bowl and definitely from Usher, because to me, that was a little stale, and I'm not going to bring up Alicia Keys. We've had a whole idealistic conversation about whether that was good or bad, and I guess you can tell from my opinion. I thought, so here we go. Again, welcome to the February edition of the Appalachian Partnership Consortium. And we call it a partnership consortium because you all are our partners. We see each and every one of you as our partner in one way, shape, or form. Today, we're going to be talking about some of the stuff that's really leading us to convening the summit. If you haven't already registered for the Appalachia Syndemic Summit that we're convening in May 19th, 20th, and 21st at the Greenbrier, please do. The registration costs go up in 2 days. And also, no matter when you register, today, tomorrow, next week, I'm going to tell you what you're going to get. You're going to get some fun. You're going to get some dialogue. But most importantly, you get to the Greenbrier for $99 a night. Talk to Lee. I don't know how he did it either. So there's that part. So I want to introduce some folks to you. I'm going to start with Vanessa from Alabama. And so tell us who you are. Okay, hold. Tell us who you are, what you do, right? And where you fall in the sibling order. And that's all you get to tell us this round.
Okay, well, I'm Vanessa Tate Finney. I'm the Director of Policy and Advocacy at AIDS Alabama. I lead the HIV and all of the associated policy and advocacy work for the state of Alabama. And I am the oldest of two.
There you go. Randy. Dandy Randy. Oh, you're on mute. There you go.
There we go. I got it now. So I'm Randy Abbott. I am a recovery resource advocate with the Alcohol and Drug Council of North Carolina, where I help connect people to resources throughout the state. I'm also an outreach specialist doing outreach to our LMEs and service providers throughout the state as well. Siblings. So I often say that I am both the youngest and only child. The reason for that is my brother was 16 years older and he was married at a very young age and had moved out by the time I was old enough to know who he was, I think. And then my sister was 10 years older. So I spent more of my formative years as an only child than I did a sibling.
All right. Okay. And I'm kind of the same way. Is that I think I have 8.5, almost 9 years between my closest sibling and I, and they were a step. Like they were. I mean, some people would call Irish twins because a couple of them are less than 9 months apart. You do the math on that one. Jordan, how about you?
Hi, everybody. Jordan Scott. I'm based in Raleigh, North Carolina, but I grew up in rural Southeast Pennsylvania my whole life. I am the advocacy and organizing coordinator with the Pennsylvania Harm Reduction Network, which is a newer statewide advocacy organization focused on public health policy. I'm also with the Expand Good Sam North Carolina Coalition. I handle a lot of their social media and our listening session initiative that we're working on. And I'm also a board member with the National Coalition to Liberate Methadone, and I consider myself a disabled drug user. And I am the third child, so that means I have the largest therapy bill, and I got left a lot of places.
So are you a middle child or the third and the youngest? So you're middle.
Yeah, I'm the third youngest out of 4.
All right, because I'm like those middle kids got issues. I talk to my sister all the time. I'm sorry, it's not my fault. I came along.
Yes,
right. All right, John, is that you? Do I see you up there hanging out ready?
Yes, ma'am. My name is John Bowman. I am the Kentucky Senior Campaign Organizer at Dream.org. I work on all things criminal justice and drug policy related in the state of Kentucky. And I am the baby of 4 kids. I'm the only boy.
Wow, and it's only boy and the youngest. Some would say the words that would come up would be spoiled rotten. Would that be the case there, John?
Yes, ma'am.
Okay, I just wanted to make sure that I understood what all of my reading about sibling order actually portends. Have I gotten everybody? Did I miss anybody? Okay, cool beans. So one of the things is this, is that one of the things I like to say is that what has happened over particularly the last, I think 3 to 5 years is that we are seeing a new partner in how we address policy. And that is the geopolitical climate that we are in. That I mean, in the past, it wasn't always that what the big politics of the nation were necessarily impacted the work that we do. But it really does now. It's like, you see more either left leaning or right leaning, or how we get to we need to help to service the people. What are the biggest policy issues you are individually, because you're in different places, seeing on the ground? One, and it's a 2-part question. What's the biggest policy issue you see right now? And number 2, what's the biggest challenge? I'm going to start with Jordan. I know John was chomping at the bit, but I'm going with Jordan. Because, his middle kids need something.
I appreciate getting thrown a bone every once in a while. I would say, especially, looking at Pennsylvania, because I'm still pretty new to North Carolina, so kind of figuring out that landscape outside of, my Good Sam work. But Pennsylvania,
Jordan, hang on, Jordan. First of all, can you tell people what the Good Samaritan law is, just to make sure everybody knows what we're talking about when you even say that?
Oh yeah, no problem. So Good Samaritan laws provide immunity protection to folks that are overdosing and people who render aid. Every state has their own law except for two. 2 states do not. I think that's Kansas and Montana. So every state other than that has their own form of that law. They all provide different levels of protections. And, currently in North Carolina, we're working on reforming the Good Samaritan law.
Okay. And so what's the thing that you're seeing now where you are that's the kind of the biggest challenge, biggest hurdle, and what's the biggest hurdle for you with it?
I think one of our biggest challenges in Pennsylvania really is the amount of attention that Kensington gets, and the political climate that's been created over the last couple of years, really contentious, especially around like overdose prevention centers, harm reduction in general. We still have not been able to legalize syringe service programs yet. And, Pittsburgh and Philadelphia get a ton of attention. They're the 2 biggest urban areas in the state. But I always tell people, you have Pittsburgh, you have Philadelphia, and then you've got the rest of Pennsylvania. And the rest of Pennsylvania is so different, especially rural Pennsylvania. So because of that, we're seeing HIV and Hep C rates go up. And we're also seeing a disturbing amount of bills relating to either involuntary commitment or, mandatory treatment.
So you're seeing things swing right. Is that what you're saying?
Mm-hmm. Even in areas like Philadelphia, like if you pay attention to the politics in Philly, it's swinging from being, fairly progressive to very conservative. I wouldn't be surprised if Philly doesn't end up, repealing their executive order that allows SSPs to operate. It's a really wild political landscape, and it heavily influences everything else in the rest of the state.
Okay, good to hear. Hey, Lindsay Bettis, I want to know how big that cat was, because it looked like a mountain lion coming behind you. I don't know how to tell you, but you got a blurred background, but that cat looked like it was a cougar. I was like, is she okay? Do we need to call 911? Do we need to call the people? Because I think she could be harmed in her own home.
He is huge. And for no reason, because he's got to be mixed with something, because when we got him, he was a tiny little kitten, but he is just huge now. And he loves to sit on the back of this chair, and then the whole chair leans back because he weighs so much.
Okay. All right. I just wanted to make sure you're okay.
We're all good over here.
Okay. If you just put something in the chat, if you need us to send somebody. Okay.
Absolutely.
All right. Okay. Okay.
Thanks for
All right.
checking.
All right. I told you we're in a partnership together. Randy, what's going on? What are you seeing where you are about a policy or a program that you see going one way, and what are your concerns about it? What's the plan?
So one of the things I failed to mention during my introduction is I am involved with Expanded SAMNC. I facilitate our meetings and help do a lot of the behind the scenes planning and promotion along with Jordan and the whole team. But there's a number of things going on right now in North Carolina. The biggest thing is we are in a governor's race this year, and there are several candidates who have made it perfectly clear that they will roll back some of the progress that's been made on things like SSBs. And we currently have a very concerning death by distribution bill that was passed last year.
Say more. Say what is that? What does that mean, Randy?
Death
by distribution.
Yeah, death by distribution laws basically state that, and they can vary. You know, some say money has to exchange hands. North Carolina's, that's not the case. If you and I are using drugs together, and I bring the drugs to the house, it's just enough for our usage, but for whatever reason you overdose and die and I do not, I can be charged with manslaughter. I can be charged with your murder.
Wow.
Okay.
Wow.
So what that does is it keeps people from calling 911 in the case of an overdose. The bill is extremely foggy and cloudy as to who it applies to, who it doesn't apply to, what the limits are for drugs that can be on hand. There's just a lot of fuzziness there. So as we're trying to expand the Good Samaritan law in North Carolina and add further protections, we're having to combat the stigma, you know, that bill and that law, I keep calling it a bill, it's a law, that law creates. So
and
that's
has that law been in? I'm sorry.
Yes, that law is in. Yeah, it's in place.
It's in place. It's been enacted. Okay.
It is in place.
All
yeah.
Right.
In fact, I looked at a map. I was on another call last week, and I looked at a map to see how things have been going in the state. And in Rockingham County, which is one of our smaller counties, they have already had 11 people charged under that law. So within the last year or so.
Wow.
So yeah, it's very concerning. It's something that we hope to be able to overcome. But again, our governor's race is something that we've got to pay very close attention to in North Carolina right now, just because of a lot of the bills that progress we've made that could potentially be overturned, depending on who gets in office.
Okay. And now, John, I'm coming to you. What are you seeing? What's going on the ground?
Oh, a lot of craziness here in the state of Kentucky. We have a bill in the works now. It's House Bill 5. It is an omnibus bill, and it has a provision what Randy was just talking about. They're trying to pass that here. You know, basically drug-induced homicide, and there is no amount that is on there. And it's really the same exact bill that Randy was talking about. Originally, they had it as a murder, and now they have taken that language out and replaced it with manslaughter. But the problem being is they expanded the sentences for manslaughter on that provision. It's not a law yet; it's still in the Senate, but as advocates in the harm reduction space, that is the Good Sam law is one of the things that we have really been trying to to keep on the books and keep expanding. And this is this bill in general is going to take Kentucky back a lot of years. All the progress we've made in the past 5 or 6 years is going to erase a lot of it. So it's a horrible piece of legislation, and we're fighting it from every angle. I know every coalition that I'm on in the state is fighting this bill. And right now it is the worst piece of legislation in the state. So we'll see how it goes. But it's definitely something that has taken all of my time and energy since they came up with this concept back in September.
Right. Okay. So here, okay, I'm gonna come Vanessa, but then I'm gonna come back to a question I got for everybody in a second. Go ahead, Vanessa. Tell us what's going on in Bama. Roll Tide, baby.
Yeah, Roll Tide. That's basically the our calling, I would say, to all of the terrible, terrible things that happen here in Alabama. You know, as I was listening to the other panelists talk about, you know, some of the progress that their state legislatures want to undo, I'm sitting here thinking, man, it'd be really cool if we had any of that progress, but we do not. We really have made very few steps forward in terms of treating people who encounter the criminal justice system as actual people. You know, even you probably saw a couple of weeks ago that Alabama executed a man using a completely untested method of nitrogen hypoxia. It was an awful execution for those who had to witness it. And I think that really sums up how Alabama views these things. I want to point out a specific case too from a couple of teenagers who were, there was a teenage couple, and the boyfriend supplied his girlfriend with a pill and not knowing that it contained fentanyl, and she died. And as a result of that, he is not being charged as a juvenile. He's being charged as an adult for murder. Also stemming from that case is a bill that passed last year in our legislative session. It was actually Senate Bill 1 that increased the penalties for fentanyl possession, that if you have more than 8 grams of fentanyl, which again, like would fit on your fingertip, you can be charged with felony distribution, and that now carries a life sentence. So we're not actually looking at this from a humanitarian aspect. I know we're going to talk about, you know, the opioid remediation dollars, but you know, so far Alabama is not really putting. Well, one, we've only allocated $10 million out of all of the money that we have received. And it has gone to the Alabama Department of Mental Health for $8.5 million. And then the other $1.5 million has gone to the Department of Corrections, which the Department of Corrections in Alabama is absolutely atrocious. I mean, there's a federal lawsuit that's been going on for several years at this point, from the federal government suing the state of Alabama for the conditions of our prisons, saying that they actually are cruel and unusual punishment.
So listen, you know, we work in the Appalachia region. You know, and for those of you who haven't heard my pitch about this, here's what I like to say. That there's a train roaring through the Appalachia region. The engine of that train used to be the opioid crisis that we knew. It's now poly drug usage driving that train. Hepatitis C, hepatitis B, hepatitis A, educational attainment challenges, workforce development challenges, economic development challenges, with the caboose of that train being HIV. And for many parts of this region, we need to imagine that train laden down with coal. The environmental impact, the economic impact, and the psychological impact of loss of those coal jobs. When I sit down and I think about how it is that we who are on this call, and I think most of the people on this call are here because A, we care about Appalachia. B, we have some relationship to substance use disorder or public health in some way. But, you know, with all of the things and the through lines that you are all talking about, is that one of the challenges is, how do we talk about and how do we talk with policymakers who may be diametrically opposed to our points of view, right? Because one of the things is that I keep looking around and I'm like, they keep going one way and we're going another way. How do we get a conversation, not so that they get all of their way or that we get all of our way, but that we do what I think that we are all here to do, which is what? Is to better serve the people of the Appalachia region and to make sure that they can get their health and economic and service needs met. So what I'm going to ask you is this: given where you are and where you're saying they are, how do you have the conversation? What's the fix? Tell me the solution. How do we fix it? Because it can't just be they introduce the bill and this is the law and then we stop. It can't be just that we're going to yell at people and then they're not going to hear us and we don't, and they stop and we, so that's not it either. How do we get to let's have dialogue? Because that's the only way we fix this, I think. But go, Jordan, I'm not going to start with you because I did that to you last time. So I'm going to start with Vanessa. I got her. Haha. I got that oldest kid. Got her. Go ahead.
Yeah, I don't know about the therapy bills being more for the middle kids, but that's just anecdotally. So this is such a great question because dialogue is just so difficult in the state of Alabama. And, you know, we've had some real hard discussions over the past year within, you know, the policy community, within, you know, not just HIV, but across the whole state. And it really comes down to the economic argument. Saving lives doesn't do it. What's just and what's right doesn't do it. It's dollars. Like, that's the only thing that makes sense to create an avenue to even potentially have any dialogue where it's like, and oh yeah, by the way, we could save a bunch of lives while doing it. That really has to be an oh, by the way, because that is not going to drive the, you know, the discussion or the argument for any of these, you know, policies that we know would make a real sincere impact in people's lives. And so we really have to, and I'm working on this right now, even with some of our federal lawmakers when we go to AIDS Watch next month. But talking about the things that, you know, the federal dollars that we're getting into the state, what are those dollars actually doing? What is the real impact of those dollars in our communities? Because it is not good enough to say like, oh my God, if you cut HOPWA, these many people will be homeless. They don't care. What they care about is what those dollars are actually doing in their individual districts. And so we've really had to think about flipping all of these arguments that we've been using for so long completely on their head and having a completely different conversation with people. Because, you know, as many times as we have, you know, productive conversations with staffers, when it gets to the actual, you know, lawmakers themselves, all they're seeing is how much a program costs and whether or not that would make a meaningful impact on the budget or the deficit. So you really have to talk about what that real impact in their districts, in their communities is, and kind of leave the human element out of it, which pains me, but that's where we are.
Right. So I'm going to come back to a bunch of you in a second. But, you know, one of the things that I keep thinking about, and, you know, some people think I'm wacky when I started to talk this way, but people think I'm wacky for a whole bunch of other reasons too. So here's the thing that I kind of start thinking about, right? I kind of start thinking about where I live, right? And where I work. You know, I work in a small town in West Virginia. I live in a small town in West Virginia. And, you know, when I start to think about it, and I think about who our local electeds are, and then, you know, some of them do make it up the ranks to state house, and some of them then run for, you know, state office and that sort of thing. When I think about it, I go back to that train, right? That train has kind of been roaring around for 2 decades. Right. So 20, 40, 20, 30 years, let's say. right? Let's say 20. The other thing I started to think about is they are now elected officials, but what they were before is John or Jane or Tim or Bob in the town that I came from. So did John or Tom or Bob or Sally or whatever their name is, what's the level of impact this has had on them, right? So, because I think about everything from the EMT worker. The EMT worker in my town isn't picking up a stranger on that bus, isn't picked up a stranger on that bus or revived a stranger or had to call or code a stranger. That's usually somebody that they know, they went to high school with, is a friend of a friend of a family member of a friend, is a relationship to them. And so I got to start to thinking that these might be the same. The case might be the same for some of our local and county elected officials as well. So if they've experienced all this trauma and we never reached back to them and said, hey, you all right? What happened to you? I mean, how did you get to the place where you thought an eighth of a 100th of an eighth of a milligram of fentanyl should end up with somebody receiving the death penalty? How'd you get there? Right? Is it that you got there because you thought this is, eye for an eye, tooth for a tooth kind of situation? Or is there some other residual trauma that you and I probably need to talk about? And I don't know if we ever kind of get them there or go back to there of how you got here. What do you think about that idea? Randy, and I'm coming to you for a whole bunch of obvious reasons.
Lord. So, there's a lot of stuff going around in my brain right now when we talk about conversation and how we have those conversations. And obviously, just as important is who we have those conversations with. I think oftentimes, when we hold events or when we hold listening sessions, which we're doing, and they're very important, but oftentimes we're kind of preaching to the folks that already agree with us, right? We've got to get to those folks that don't agree with us, and we've got to have those hard conversations. And oftentimes that has to be more one-on-one. I use the example. I had that very conversation with a legislator who was pushing for our drug-induced homicide law. And I had the story of my daughter. I lost my daughter in 2015 to a drug overdose. And the group she was with panicked. They did not call 911. And I had the conversation about the person who gave her the drugs. And I'm sort of ashamed to admit it, but not ashamed to admit it, that very first year, I wanted to see, and she knows that I tell this story and she's told it with me, so I could use her name. I wanted to see Kelly, who was my daughter's best friend, but who also gave her the drugs. I wanted to see her in jail. I was hurting. I'd lost my daughter. It took me a year to get to the point where I could sit down with her, have a cup of coffee, and find forgiveness and begin to form a relationship, a working relationship with that young lady. Okay. She went on to work for an organization called Alamance Cares, which unfortunately no longer exists, that worked with at-risk younger teen females, primarily between the ages of 13 and 21, who were at high risk for trafficking and sexually transmitted diseases and drug use, and was changing lives. I actually had the opportunity to sit down with the legislator, one of the lead sponsors on the drug-induced homicide bill, and I saw the lights come on in him. I didn't change his mind, unfortunately. But he did tell me, you've given me a lot to think about with the way we word this bill. That was the original DIH bill. He said, you've given me a lot to think about with how we word this bill. His motivation was his next door neighbor lost their child, and they were really good friends with the next door neighbor. That was his motivation, was to make stronger laws, to kind of go to the arrest me mentality, or arrest them mentality, I guess. So, to how we have those conversations, we just have to find ways to get face to face not just with legislators, but with people in our community, because those are the people who the legislators serve. And if we get enough of them talking to their legislators and their local sheriffs and their local politicians, to change mindsets, that's the key. And that's also the hardest thing we have to do.
Right, right. Jordan.
I hope that answered the question.
It does, because I think it's like, and remember what I said earlier, this is like us having coffee. So I get, everybody jump in when you feel like you jump in. There's no decorum here, as you can see. But I think that the thing is that that's just it, right? It's like, we've got to be able to have a conversation. And I think if we're so wedded to our position that says, I can't have a conversation with you because you are so polar opposite to me, then we never have the space for me to even remotely try to give you a little grain of something that may not change your mind today, but gives you food for thought for tomorrow. I think that there's that piece of it. And then that for me, it's the piece of, it may not even be about this issue. It may not be about harm reduction today, but it may be a conversation that we have to have about the fact that we both like socks that are fancy, and gives me a reason to come back, a reason for us to have a conversation in the future. I got a Clayton Ruley that has his hand up. Clayton?
Yeah, how's everyone doing? I just wanted to comment, and it kind of goes with what you were just saying. I think, unfortunately, it can't be a single issue type of conversation. I do think that bringing the financial benefits of some of the work that we're talking about can be helpful, but I think overall there's a lack of political education in a lot of spaces, and so I think there needs to be a reboot in some ways of what people think they know compared to what they know. It's really easy in this environment to I think be wrong and continue to be justified because from many people's sources, they're never told that, things are different than they actually are. That's on both sides of the spectrum. I would say one more than the other by a decent amount. So I think that, that question about, or that thought that you had about, common, shared, things, and trying to break it down and then continuing to progress the conversation. I think about, harm reduction, not just around like the drug use and the sex work and the unhoused, but reminding folks that we do a lot of this harm reduction and risk reduction in daily lives is a eye opener for some folks who don't always take the time to think about the little things that they do. I think that needs to get teased out a lot more with folks. I also think in general, instead of always trying to tackle the state rep, the city council person, the person on the higher levels, it needs to be more local. I think you need to get a lot more buy-in with parents and people from recovery communities. They a lot of times can be a bigger voice than they are often in a lot of communities, and some of them carry some of the same misinformation about everything from buprenorphine to what naloxone does or doesn't, to giving people more access to healthcare and treatment options that just adds on to the issues that we're facing. Last thing I'll say is, I think the frustrating thing about the work that a lot of us are doing right now was, I would say 15 years ago, 10 years ago, there was unwilling ignorance amongst a lot of the people that we were trying to engage around accessing services policy-wise. And now, similar to a lot of, the structures you're seeing, both, federally, statewide, and in my case, citywide, it's not a unwilling ignorance, it's a willing ignorance. So, there's been public health, there's been research, there's data that says that initiatives that a lot of us on this call are trying to initiate have saved many lives and have changed livelihoods and saved a boatload of money, but similar to other, things that folks are trying to do nationwide, statewide, and citywide, in areas all over, it's not about whether it actually does what, all of us, most of us have been, I think, raised to believe was the right thing, like actual science and data, public health strategies implement, are going to do good. Now it's just like, well, I just don't like it, so I'm not going to support it whether I like it or whether it saves money, saves lives or not. So that's the challenge that I definitely see in this the work that we're doing right now.
Thanks, Clayton.
Thanks.
And thank you for sharing all that. And and I think that for me, one of the things I keep coming back to is not just that folks don't pay attention to science and data anymore, but I think that we misstep too. Because one of the things that we don't kind of go back and do is that we don't do in a lot of cases, the surveys of their constituencies and say, is that what you meant for him to do? Is that what you meant for him to pass? Is that what you meant for her to enact? Is that what you meant to do? And sometimes is that we are going to have to kind of take a step back and then kind of go after the fact to fix some things. But I think that those are questions that we are going to have to answer. I think we're going to see more and more of these laws, but I think the other question is that what their constituencies meant? And yes, people tend to and can vote against their own best interest, but I don't know that we know that that's really what they meant to do on this issue, right? It might have been for another issue or that issue, but on this issue, is that the law that you meant? And if that is, then we have another set of work to do, because I think we're not always sure about what the work is that we need to do. Is it that we need to be doing the community level engagement and education Clayton was bringing up? Is it the member level engagement that we were talking about earlier? Is it that we need to be doing the advocacy just to change the laws and we all run for office and so we can change the laws that way? But I think that it is a combination of those things. John or Jordan, I was coming to you. That's where I was going.
So I
know where I was going.
I think it's a combination of things. It's one, like, I hate that saying of like, don't talk about religion or politics. Like, no, I think that was like one of the worst things that society collectively decided to do, because now we have several generations of people that don't know how to engage in conversations that even touch in the realm of, politics and religion. I'm from, rural Southeast Pennsylvania, but also spent years living in Philly, using in Philly, being homeless in Philly. Now I'm down in Raleigh. And so a lot of the people around me are very white, very conservative. I'm in the Bible Belt. And my partner always gets nervous when I start having conversations, because he's like, it's like a ticking time bomb. And I'm like, why are you so freaked out? Like, we're talking. He's like, I'm like, we're just having a conversation, like we're having dialogue. So I think one, like, needing to be willing to engage in those conversations, but even that is multifaceted, right? Because I look at so who I am in, as a harm reductionist and the work that I do in that space, and also who I am as a disabled person, as a drug user, as a community organizer, like, all these different intersections. And we also have to know who is the right messenger. Like, so for example, I tend to not engage much in the parent space because I am just not the right messenger, right? For my own mental well-being, because once you've been called a murderer a couple times, like, it gets pretty exhausting. So I know that, right? And that's a boundary I have. I typically will pass that off to somebody else, like Randy. So, for us on this side, being aware of our limitations and our biases and respecting that, right? And knowing that we are not always going to be the right messenger. Also, like, I can't pick and choose who I engage with. It's one of my biggest bones that I have to pick. Like, when I made that transition from like direct service work to policy work, right? Is that, well, I can't believe, you met with that senator. Listen, there are some politicians that I personally find them absolutely be deplorable human beings. And after meeting with them, like I go like, I feel like I have to shower. But when I'm trying to pass laws, when I'm trying to change policy to benefit like my fellow drug users and my community members, I don't have a choice. Like it is not an option of whether or not to engage. So like we can't pick and choose those battles. We have to engage when we have the right messenger. And also like we have to create spaces where people feel comfortable asking the stupid questions. You know, because I know like sometimes I forget like that even just a few years ago, I didn't know what I know right now. Like everybody is starting somewhere. So I can't roll my eyes when somebody asks a question, well, why isn't it just getting high if somebody's on methadone? I can't do that. You know, we have to create those spaces where people can feel comfortable being vulnerable, because that's what we're asking people to do, to have an uncomfortable conversation. Is you have to be vulnerable. And like I don't know about everybody else, but I still like don't always enjoy being vulnerable, especially in spaces where like I don't know what's gonna happen. And I also like lastly
Yeah,
like
no, I mean, go ahead. No, go ahead.
just say I think and lastly like really like we have to stop trying to do things with the system that we want. And like, we need to do things with the system that we have, right? Policy is a giant game of chess. As much as it sucks and as much as it shouldn't be, and it feels disgusting to be playing a chess game with human lives, it's the system that we currently have to operate at. And so until somebody figures out how to change that, like we got to do what we got to do. And as soon as I was able to understand that and like internalize it, it made life a lot easier.
You know, what I say is that, it's like a dating app, right? You know, there's like 1,000 people on a dating app. And you go on that dating app and you think you got a whole bunch of chances. You're like, I got 1,001 chances because there's 1,020,000 people on here. So I got a shot. But after that 20th rejection or that 20th no response, you're like, hey, wait a minute, is it me or is it them? And what I'm saying is that what we keep doing is that we are so afraid of the no, I don't agree with you. No, I'm not doing what you want me to do. Or no, it's never going to happen. Or yeah, maybe we can go to dinner, but that's as far as this is going to go. Right? I think that what we've got to understand is that maybe we have to keep going back. We have to keep going back with a different conversation. Okay, so maybe we can't go. Maybe we're not going to be long term together. Maybe that's not what we're going to be. But maybe what we can do is go axe throwing together. Maybe we could go out for drinks. Maybe we could go to the place where you go make the cups at, where, the little kiln place. Maybe we can do a paint and sip. Maybe we become friends. Maybe we don't become, but we've got to figure out like that rejection isn't rejection in the same way always, right? And maybe we don't get everything we want. Maybe they don't get everything they want. Maybe I get no today, but I don't get no forever. Now it's on you, John. And I never saw you when I was on a dating app. I'm not just trying to like lead in with that.
For me, I like having those tough conversations and finding those unlikely allies. For someone in long-term recovery and, someone who works in the harm reduction space, I found a couple different police departments throughout the state to work very closely with, which was weird. One of them was in my hometown. And really seeing that, we're all wanting the same thing. We're just looking at it from different angles. And it's the same way when I speak with politicians, I have to work on both sides of the aisle. I don't get to work on one side or the other. To do what I need to do, I have to work with right and left. So I have to find common ground somewhere. I have to find something that I can talk to them about, and I have to go in level-headed and keep my cool, because I know somebody's going to say something to piss me off. Usually, it's something I don't agree with, but I have to be able to maintain my composure and listen to something from their perspective. and also be very transparent in, you know, the things that I've been through in life. Someone who's been in recovery, someone spent over half their life in active addiction, who's just as impacted, and be willing to share my story with them and let them see things from my perspective as well, and see if we can't find a starting point. We're not going to agree on everything. It doesn't matter which side of the aisle they're on. We're not going to agree with everything, but if we can find a place to start, that's my big thing. I just had to find a starting point, and we can build from there. And it is about relationships. It's building relationships with these people. It doesn't have to be, like you said, it doesn't have to be that dating relationship, but you have to have some kind of rapport with the people that, you know, you have to work with. So any starting point that I can find, some kind of common ground, whether it's workforce development, if it's, you know, anything to do with money in Kentucky, you know, anything on that area. And a lot of times I can start with recovery, because we have grown leaps and bounds here in Kentucky when it comes to recovery. And a lot of the legislators are on board with the recovery side of it. So usually I start there. That usually gets the conversation started, and then we can go from there. But it's usually just finding something that we can talk about. And just, you know, I don't always have to jump in right with my issue. I just have to find that starting point to have a conversation. And that's my goal when I go into meetings with people, is how can we start this conversation? You know, it doesn't have to be, oh, I don't want you to vote this way on this bill or this way on this bill, or, oh, this is my issue. It's, you know, I'm going to tell you a little bit about me. You tell me a little bit about you, and let's see where we can start, and just have a conversation.
Right. You know, I mean, I was just in Burke County, North Carolina, and talking to them about some of what they're going to do with some of their opioid settlement dollars and kind of what their plan is and all of that. And, you know, we were there with one of the folks from a large hospital system who kind of, he supports Matt. He supports Matt in PC in primary care settings and all this stuff, but he kind of didn't see the whole, like, let's bring all the community in here and have one big conversation, the kumbaya that I was hoping for, or the what we like to call here learning collaboratives, where we bring primary care with harm reduction, with policy people, with harm reductionists, with people with lived experience, learning collaborative, so we can all learn from one another in order to move these things forward, especially with all of these opioid remediation dollars out there that are coming through AG's offices, which is all a new vehicle, right? Now, he's a great guy. You know, we didn't have like one moment of angst. But what our conversation started was, I said, hey, amazing timepiece you have there on your arm. And he looked down and he goes, you notice that? I said, well, yes, sir, from across the room. I knew it was a blah, blah, blah. I'm not going to tell you what kind of watch the man had on, but it was like, yeah, blah, 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 blah. He's like, yeah, no, it's a goal of mine to get a blah, 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 blah someday. I can't get, he later after that, he gave me his card and he said, hey, can you talk to me? Because I thought that I should buy it off of blah, 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 blah. And I was like, no, use this website over here. And our conversation was about that. But our conversation was the conversation that let me send him an email and follow up with him later. He responded very quickly, thanked me for it, and said, you know, next time you're in Burke, please stop by my office. I'd love to talk to you about a couple of the other things you mentioned. So it was a thing that had nothing to do with our thing, but is now leading me back to our thing. Vanessa, Lee got off camera because now he's going to want to talk about some hard-hitting policy issue or something while we're having fun. He's a dream killer, I tell you, a dream killer.
Go
ahead, Vanessa.
All right, Vanessa, me after you.
So I was putting in the chat, but no, it's very, very true. You have to start with that totally innocuous subject to disarm people, and then start working your way towards the conversation. And I mean, yes, jokingly, yes, we start with talking about Alabama football, unless it's Tommy Tuberville's office, in which case then it's War Eagle. But yeah, you absolutely have to work your way into those conversations. I actually have a great relationship now with one of the representatives in the state of Alabama, with one of his staffers, because we happen to be wearing the same brand of shoes the first meeting we ever had. And I noticed it and pointed it out. And then the next time I saw him, I was like, oh yeah, we were wearing the same sneakers. So that's very, very important. Sorry, cat. But beyond that, though, you also have to understand that, well, okay, so for example, with that particular staffer, actually, we ended up having, I was at Sex Ed on the Hill back in September, and ended up having a conversation, a very, very productive conversation with this particular staffer about sex education in Alabama, because we were able to have come together at the table and say, like, listen, okay, abortion's completely off the table. So what I want and what you want in terms of that subject does not matter. But there are all sorts of ways in which we can find crossover on the things that we both care about and can figure out a way to collaborate on how to achieve our goals that are within this narrow middle area. And so it is so important to figure out where that middle area is on whatever it is you're talking about, because incremental progress is still progress. And so I know a lot of people on both sides are like, well, it's all or nothing, but all or nothing, especially in today's political climate, is just not possible. So we have to figure out where that incremental progress in the middle can actually happen.
So
Lee?
I know we've been talking about a lot of different state policy work. We wanted to give a shout out to a new launch of a partnership that's happening in West Virginia. Teresa, our partner at Marshall University, can I pass it to you just for like 2 minutes to share about y'all's new hepatitis launch event happening this week?
I appreciate that, Lee. I'll tell you, this has been a thought-provoking conversation, and it's encouraging knowing that there's other people out there that want to create change. So I'm with my people, so that's beautiful. So thank you guys for being here with us. And I'm going to end our conversation on a bit of a hope. We are doing a project right now with the Bureau for Public Health. It's a CDC grant, and it's hepatitis C and hope. And what we're doing is partnering with peer navigators throughout Southern West Virginia and having them link with individuals who want to get testing and treatment for hepatitis C. These are justice impacted individuals we're engaging. Right now, we just started the project and we've already met with 168 individuals. Out of the 168 who were tested, 20% were positive for hepatitis C, and we've now engaged them in treatment. So there's just, it's a really neat experience because the persons who they're working with also offer supportive counseling during the process. So it's not so scary to go through. And I wanted to invite you guys to a party. We're having a launch party on February the 14th via the internet. I will put the link in the chat right now. I'm middle-aged, so pasting a link and talking are quite a challenge for me. If you'd like to register and join us, we'd love to have you, tell you about the program, introduce you to our navigators. And if you have anyone who would want to be part of this project, please let me know. And we also offer some incentives for people once they get tested. They do get a gift card incentive. And if they do need treatment and complete their treatment successfully, we also offer another incentive. So it's just a great program to work on the eradication of hep C in Appalachia. And as you can tell from my accent, I'm originally from Appalachia, and I'm the baby of the family.
You know what I say? I say the babies are the best, but I guess you know where I fall in line. Danny, do you have something for us?
No, just to say the best of luck, because we've been doing this model for the past year at VHRC and it works really, really well. The incentive for testing and then the incentive for treatment is a very effective model. So very excited for you guys.
And we hope to see you then. This is great.
I've copied the link. I'll invite if you guys want to talk to my hepatitis treatment coordinator, who's been doing this model for like 1.5 years now, in a rural Appalachian setting. We're in Roanoke, but we also serve like Patrick County, which is part of the ARC. So I'll drop my email in there, Teresa, if you want to talk to her at all. She has lived experience. She's been unhoused with injection drug use and hepatitis C. She's a great navigator and would be happy to chat with you guys if you'd like.
I'd love to. Thank you, Danny. And also go to our website. We have several videos of persons who have been impacted and they share their story. It's really a neat experience.
Okay, well, cool beans.
Thank you.
And that's, listen, and so for those of you that this is your first time, like those dating sites, I hope it's not your last time that you come by and see us and share with us things like Teresa's project. And Teresa, we're probably gonna maybe reach out to you with some stuff that we're doing because we really want to get MAP providers more engaged in Hep C screening and in offering PrEP, Hep C screening and HIV screening, and not letting folks necessarily opt out. This has been a very illuminating conversation for me. I'm super excited that you all were able to spend an hour your afternoon with me and with us and to share this conversation, because I think that this conversation, I can't remember who it was. I think it was Corey who said, hey, we are losing the art of compromise. And in this moment in time, it is often difficult for us to find those through lines, to grab at those threads of compromise. And sometimes it's all, honestly, we have to hold on to. Our mission, our goal here at Community Education Group is to bring resources, opportunity, and attention to the needs of the people of the Appalachia region. And I'm super excited to call each and every one of you partners that have been on this call with us today, because that's what we got to do. And the only way we do that is if we stick together. And there are folks out there that need us that we have not met yet. And there are folks out there that need us that we will never meet. But if we stay together and continue on the path forward, we can do the thing that we need to do, bring resources, opportunity, and attention to their needs. So I want to thank each and every one of you for the work that you do. And I want to thank each and every one of you for taking an hour out of your day to listen, to chat, to share. And if you have any other ideas about kind of what we could talk about here, please feel free to bother Lee with that. Don't call me with that. I don't really want to know. Tell Lee. But honestly and truly, thank you. Thank you, John. Thank you, Jordan. Thank you, Vanessa. Thank you, Randy. Thank you, Clayton. Thank you, Danny. Thank you, Teresa, for really being able to share with your community partners what it is that you do and how we can all do it a little bit better. Thank you.
Thank you.